Good morning. It's Wednesday, October 22nd, 2025. INEC's continuous voter registration is still on. Use the opportunity to register to vote. On the news this morning, at least 30 people killed in a tanker explosion in Niger State. Supreme Court reserves judgment on suit challenging emergency rule in Rivers State. Governor Fubara vows to relocate the hazardous dump site along Airport Road. Rivers Assembly Speaker Martin Amehule says his legacy will stand the test of time. And we've got full reactions to the Nnamdi Kanu protest and the EndSARS anniversary. Details of these and more after this break. With the news. Now, we begin the news this morning with a tragic incident in Niger State where at least 30 people have been killed and about 40 others injured in a tanker explosion. The explosion happened around 11 a.m. on Tuesday at Esan and Badegi communities along the Bida Agaye Road in Kacha local government area. The Federal Road Safety Corps Sector Commander, Niger Command, Hajiya Aishatu Saadu, confirmed the incident on Tuesday in Minna. Eyewitnesses say the victims were scooping fuel from a fallen tanker when it suddenly exploded, triggering a massive fire that burned several people beyond recognition. Chairman of the Niger State Tanker Drivers Association, Farouk Kawo, describes the incident as IA alone, blaming the crashes on the poor state tankers. He called on Governor Umar Bago to urgently fix the road to prevent more tragedies. Away from the tragedy and back here in Rivers State, if you are a resident along the Obirikwere Airport Road or pass through that road and have suffered from the stench from the dump site there, let's tell you that there is good news. Now, Rivers State Governor Siminalayi Fubara says the dump site along the Obirikwere Airport Road will soon be relocated. Governor Fubara made this known while inspecting work at the proposed new dump site in Omweke Iguruta, Ikwere local government area. Now, he says the current dump site poses serious environmental hazard and praised the Rivers State Waste Management Agency, Ruwama, for its effort to keep the state clean.
So we're making alternative arrangements so that we can have permanent place where we can start dropping our refuse. There's something going on before I came in. Whichever one that is done rightly, we have not concluded the issue of the borough pit, but the road, access road to this borough pit, I think the government are doing something about it. So we'll make sure that everything that needs to be done to make sure that government owns this borough pit is done.
The governor was taken around the new site by the chairman of Ruwama, Dr. Samuel Wanosike, and the managing director, Dr. Ibimina Wokoma. Our correspondent reports that Governor Fubara also inspected the ongoing construction of 29 full-bedroom duplexes for permanent secretaries in Elimbu, Obiakpo local government area, and expressed satisfaction with the progress of work. Now, in a related story, to strengthen the healthcare system in Rivers State, the state government has allocated over 15% of the 2025 budget to health, exceeding the WHO's recommendation. Deputy Governor Professor Ngozi Odo revealed this at the opening of the 2025 Physicians Week in Port Harcourt. She says the state remains committed to investing in healthcare and embracing innovations like artificial intelligence while maintaining ethics and the human touch.
We remain committed to strengthening our healthcare system through robust policies, strategic investments, and a people-first approach. In the 2025 appropriation bill, allocation to health in Rivers State was over 15%, which is actually higher than the WHO minimum, and we can only get better.
The Rivers Deputy Governor says this year's theme, Healthcare as a Value Chain, Building Efficiency from Policy to Patient, highlight the need to connect sound policies with better service delivery, putting patients at the center.
As we embrace innovations such as AI, artificial intelligence, we must also remain vigilant about the ethical implications and uphold the irreplaceable role of the physician.